Good day, everyone, and welcome to this session. In this video, we will continue our discussion on Foundation, Chain of Survival, and CABD Sequence. In our previous lesson, we defined basic life support and described basic life support purpose. By the end of this lesson, you should be able to list and explain the 6 links of the chain of survival, including recovery. Demonstrate the CABD sequence in the correct order. Now let's look at what chain of survival is and what are its 6 links. The chain of survival is a sequence of important actions that improve survival after cardiac arrest. Each step supports the next. If one step is delayed or weak, the chance of survival falls. The 6 links are early recognition and activation of emergency response. This means recognizing unresponsiveness, absence of normal breathing, or no pulse and calling for help immediately. Early CPR. This means starting high-quality CPR quickly to keep blood flowing to the brain and heart. Rapid defibrillation. This means using an AED as soon as possible when a shockable rhythm may be present. Effective advanced life support. This includes advanced airway care, drugs, vascular access, ECG monitoring, and treatment of reversible causes by trained professionals. Post-resuscitation care. This focuses on protecting organs and preventing further injury after return of spontaneous circulation. Recovery. This newest link includes rehabilitation, emotional support, follow-up care, and return to daily life after survival. Note, survival depends on the whole chain working well, from collapse to recovery. Next, what is the CABD sequence and why is it used? The CABD sequence is the organized order used in BLS when managing cardiac arrest. This order is used because circulation must be restored quickly when there is no pulse. Now, let's break down the CABD sequence. The letter C stands for circulation. Begin chest compressions immediately once cardiac arrest is confirmed for adults. Compress 5 to 6 cm deep. Compress at 100 to 120 per minute. Allow full chest recoil. Keep interruptions very short. Rotate compressors every 2 minutes if possible. Letter A means airway. Open the airway using head tilt chin lift if trauma is not suspected. Use jaw thrust if trauma is suspected. B means breathing. Give effective rescue breaths. Each breath should last about 1 second and produce visible chest rise. Avoid excessive ventilation. And D means defibrillation. Attach the AED as soon as available. Follow its prompts. Clear the patient for shock delivery, and resume CPR immediately after shock if advised. Note, CABD helps the rescuer follow a clear order instead of panicking. Let's quickly look at how scene safety and initial assessment should be performed. Before approaching the patient, the rescuer must first make sure the scene is safe. Look for hazards such as live electricity, traffic, moving machinery, fire or smoke, chemical or gas leaks, body fluids, sharp objects. After confirming safety, approach the patient from the front or side. Tap the shoulders gently. Speak loudly, "Are you okay?" Look for any response. If there is no response, shout for help. Check breathing and pulse at the same time for no more than 10 seconds. Look for chest movement. Listen for breath sounds. Feel for air movement. Check the carotid pulse in adults. Correct next action. When breathing and pulse is present, place in recovery position and monitor. When pulse is present but no breathing, Rescue breaths at 1 breath every 5 to 6 seconds. When there is no pulse and no normal breathing, begin CPR immediately. Note: if working alone, activate emergency response after confirming the emergency. If others are present, one person should call 112 in Nigeria while another begins CPR and another gets the AED. A structured initial assessment prevents dangerous delay and confusion. In summary, always follow a structured approach, which are early recognition, CPR, defibrillation, advanced care, and recovery. Use CABD to guide actions when someone is in cardiac arrest. Always deliver high-quality compressions, manage airway, give effective breaths, and use an AED early. Also ensure the scene is safe, check responsiveness, and call for help immediately if unresponsive. We have come to the end of this session. Thank you for watching. See you in the next session.